おはようございます。私はジンです。どうぞよろしくお願いします。Good morning, everyone. I'm Ling Chen from Taipei Medical University, and it's my great honor to give a speech here. My topic today is effect of matcha on Taiwanese cafeteria diet, induced rat model of non-alcoholic fatty liver disease. And this is my outline today. After a self-introduction, I'm going to talk about the non-alcoholic fatty liver disease. The following will be abbreviated to NAFO, and the animal model of NAFO, Taiwanese cafeteria diets, and effect of matcha on Taiwanese cafeteria diet-induced rat model of NAFO. And this is my educational background. I obtained my master and a PhD degree from Taipei Medical University. My study was focused on chemical and alcoholic liver disease. My advisor is Professor Yang Su-Qing. And when I was a PhD student, it was so lucky that I have an opportunity to study in Professor Komai's lab in Tohoku University about 18 years ago. and now my study is focusing on NAFO, and our lab is the first one to establish the Taiwanese cafeteria diet, which can successfully induce NAFO in rat model. And the term NAFO was first introduced in 1986. It defines as the histological presence of steatosis in above 5% of hepatocytes and absence of significant alcohol use. And now NAFO becomes a leading cause of chronic liver disease. And it is known that obesity is very closely associated with NAFO. And in this picture shows that the prevalence of NAFO are different by world region. And among the Asia country, Southeast Asia show the higher prevalence rate. And Taiwan has the second highest prevalence rate in Asia country, followed by South Korea and China. On the other hand, Japan has a very low NAFO prevalence, about 22.3%, which may be related to the low prevalence of obesity. And this picture shows that NAFO includes a spectrum of liver disorder, which ranging from steatosis, inflammation, fibrosis, cirrhosis, and hepatocellular carcinoma. And this picture also emphasizes that NAFO is closely associated with obesity, insulin resistance, diabetes, and also cardiovascular disease. And the risk factor of NAFO are showing below, such as the metabolic disorder, age, sex, genetic, and other environmental factors. And among them, diet and lifestyle is the most important of all. Unhealthy food like Western diet leads to dysbiosis of gut microbiota and small intestinal bacterial overgrowth. Both of them can lead to loss of gut integrity. Under such condition, harmful metabolites from gut microbiota can translate to the liver via the portal vein, therefore cause liver inflammation and injury. Due to the absence of positive criteria of the NAFO, international expert has updated the name of the disease as metabolic associated fatty liver disease. And the following is the positive criteria, such as the higher waist circumference, higher blood pressure, higher plasma triglyceride, lower HDL-C, and also pre-diabetes and insulin resistant, and the higher C-reactive protein. As of today, there are no approved drugs for the treatment of NAFLD. The most recommended treatment for the patient with NAFLD are Mediterranean diet and physical exercise. On the other hand, it is important to minimize fast food, sweet and sugar content beverage. And there are several animal diets to study to induce obesity, and the diet can also successfully induce NAFLD. The most widely used are high-fat diets, mainly at 45% and 60%. And the cafeteria diet is also a popular animal diet in Western countries. Cafeteria diet was used to study obesity about 40 years ago, and now it became more popular to study metabolic disorder, insulin resistance, and NAFLD. Lab rodents can eat the same ultra-processed, unhealthy, but tasty food that human intake, such as bacon, muffin, and cookies. And those foods can be easily bought at the local supermarket. So the diet also called junk food diet, supermarket diet, and Western diet. This is the standard ingredient of cafeteria diet. It should be composed of junk food, processed meat, and it should be mixed well with the animal standard diet. Junk food like such as muffin, donuts, cream, cookies, potato chips, and crackers. It combines both high fat and high carbohydrate property. Also, it should be include salty and sweet taste. On the other hand, processed meats such as bacon, hot dog, and sausage are also an important part in the cafeteria diet. And researchers can select junk food and processed meat in their own country, but it should meet the standard ingredient. And our lab is the first one to establish Taiwanese cafeteria diet. It composed of cheese sandwich cookies, cream puff cookies, potato chips, and Taiwanese sausage. And after feeding rats, those foods should be mixed well with the animal standard diets. And we conduct the following 2 animal studies. The first one is a 12-week animal study. The Taiwanese cafeteria diet was compared to the traditional 60% high-fat diets. Our results show that both Taiwanese cafeteria diets and the traditional high-fat diets can significantly increase the final body weight and the adipose tissue weight. However, only Taiwanese cafeteria diet significantly enhance the plasma triglyceride, which is the hallmark of the NAFLD. And this result show that Taiwanese cafeteria diet significantly induce insulin resistance, such as increased blood sugar and higher hormone IR by means of decrease the protein level of IRS1. And this results show that Taiwanese cafeteria diet, but not traditional high-fat diet, significantly increase the liver TNF-alpha, interleukin-6, and interleukin-1 concentration, which indicates the cytokines imbalance. And we also find out that cafeteria diet disrupt the gut microbiota composition. And we highlight that the Taiwanese cafeteria diet increase the level of Saccharomyces, lactobacillus, and lactobacillus. And those are related to inflammation and obesity. In the first animal study, we conclude that compared to a traditional high-fat diet, the Taiwanese cafeteria diet is more better to induce novel in animal model and more closely reflected the Western diets in Taiwanese society. And our second study is effect of matcha on Taiwanese cafeteria diet induced rat model of novel. And matcha is a power form of Japanese green tea, and it makes in 6 steps. The first step is shading, and this step contribute to enhance the functional components such as amino acid, chlorophyll, and theanine. And in our second animal study, the matcha powder was kindly given by Japanese company. And we found that the main ingredient of the matcha green tea is EGCG. And the second study is also a 12-week animal study. Rats can obtain matcha at 0.2 and 1% of matcha powder, which equal to 1.2 and 6 grams per day for a 60 kilogram person. And this is our result. We found that the Taiwanese cafeteria diet can significantly increase hepatic triglyceride level, and also increase the liver TC and TG level. On the other hand, the 2 dosage of matcha can decrease plasma and the liver triglyceride level. And consistent with the liver triglyceride concentration, we found that the HE stand of the liver tissue also show lower steatosis score in the matcha group. And also we found that at the end of the study, Taiwanese cafeteria diet can significantly induce blood sugar, insulin, and significantly increase the hormone IR. In addition, the Taiwanese cafeteria diet cause higher liver TNF-alpha, interleukin-6, and interleukin-10 concentration. And on the other hand, the 2 dosage of matcha can improve the insulin resistance and the cytokines imbalance. And also, the Taiwanese cafeteria diet disrupt the gut microbiota composition, but matcha can restore it. And we highlight that the matcha can increase the relative level of parabacteroid, Akkermansia, and fecali bacteria, and those are relieve obesity, diabetes, and metabolic disorder. So in the second study, we conclude that under 12-week matcha feeding, under 12-week cafeteria diet feeding, matcha can improve the insulin resistance, inflammation, and lipid accumulation. Also, matcha can restore the gut microbiota composition. Thank you for listening. And I just really want to thank my supervisor, Professor Yang Su-Qing, and my senior, my junior, and all the members in my lab, and all the members in College of Nutrition at TMU. Thank you.